Hello, this is Luis. Welcome to the HDTV updates from the 58th EASD 2022 annual meeting. Today we bring you the Day 2 updates of EASD 2022. Amanda gave a presentation today on the UKPDS study, legacy effect, and data up to 44 years of follow-up. According to her, the glycemic legacy effect is actually the hyperglycemic legacy effect. Establishing and maintaining near normal glycemia from the start can reduce the risk of diabetic complications and help one live longer. Early metformin medication appears to lower the risk of complications and extend life expectancy, while near glucose-lowering medicines lessen the risk of some diabetes complications. Maintaining near normal glycemia is critical for reducing the risk of complications to the maximum extent feasible. Patel presented a session that demonstrated that once-daily subcutaneous liraglutide reduced mean anterior thigh muscle fat infiltration compared to placebo in overweight or obese people who did not have diabetes. The significance of improved muscle fat infiltration to the cardiometabolic effects of liraglutide warrants additional investigation. Hansen presented a post-hoc analysis of the priority study, which showed that individuals with normoalbuminuric type 2 diabetes and retinopathy had a higher risk of developing albuminuria, but not impaired kidney function, and a significantly higher risk of cardiovascular disease during the 3-year follow-up compared to individuals without retinopathy. Kim delivered a session that examined the relationship between Fenofibrate use and diabetic retinopathy development in individuals with type 2 diabetes and metabolic syndrome who were taking statins. In this propensity-weighted cohort analysis of individuals with type 2 diabetes and metabolic syndrome, adding fenofibrate to statins was linked with a considerably decreased risk of diabetic retinopathy development than statin treatment alone. Cordiner examined the prevalence of clinical determinants of severe hypoglycaemia in type 2 diabetes patients taking insulin and sulphonylureas. The incidence of severe hypoglycemia linked with sulphonylurea has been observed to be low, more than a third lower than that of insulin. However, certain people are at a significant risk even when treated with sulphonylurea, such as elderly women with long-term diabetes and low HbA1c. Rylestone presented the results of the PACE study, which demonstrated that a CGM device with an urgent low soon alert reduces exposure to level 2 hypoglycemia when compared to real-time continuous glucose monitoring with a threshold alarm. In addition, compared to a threshold alert, an urgent low soon alert decreases exposure to disabling hypoglycemia below 2.8 millimoles per liter in the 24 hours following exercise. These findings imply that people with type 1 diabetes who exercise regularly benefit the most from a predictive alert monitoring system. This concludes our coverage of the HDTV updates for Day 2 of the EASD 2022. We'll meet again tomorrow. Have a good day.